Great. So happy to have all of you here again. Hi, a proper hi now. Thank you for completing the survey. So today we are talking about reproductive justice, and thankfully we want to thank Arrow for helping us organize this, co-organize this. Today I would love to introduce to you Siva. Siva Thanenthiran is the executive director of Arrow. Arrow is the Asian Pacific Resource and Research Center for Women. And Siva is a dedicated advocate for sexual and reproductive health and rights, like most of us here. And she has led Arrow's initiatives on the intersection of SRHR with critical development issues such as climate change, food security, and migration. And today she's going to hold for us this amazing webinar in which she'll share her knowledge on reproductive justice and how we can apply it to our communities. Also, after her presentation, there's going to be a little Q&A. You can also drop your questions in the chat below if you want, and Siva's going to reply to them when she reads the chat. And then we are going to do breakout rooms, and we are going to receive scenarios. And I hope that if you have been here for the first webinar, we have learned a little bit more about breakout rooms. So I'm pretty sure this is going to go more smoothly than the first time. So Siva, to you, and I'll just make a little bit of, I will just say that please speak slowly, because our translators are doing simultaneous translation. And I say that because I have received my own, I've been scolded before for speaking too fast. All right, over to you.
Thanks, Dominique, for that very generous introduction. By the way, because I will be presenting a PowerPoint. So if at any point, Dominique, you think I'm going too fast, please unmute yourself. Don't put anything in the chat. I can't see anything except my PowerPoint. So just say, Siva, slow down or something like that, right? So
All right, got
yeah.
it.
Yeah, so thank you to Shruti and Dominique that for inviting me to do this. We're happy to share whatever knowledge that we have gained as Arrow and myself personally as well. We started off this work on reproductive justice to see how is it that the reproductive justice as a concept could apply to, of course, or could work or not work for us as advocates from the Asia and the Pacific region, and what type of different facets could we have in reproductive justice. I think some of you already know that, this reproductive justice comes from the African American or Black American feminist movement, who were critiquing the focus, right, on choice and abortion rights exclusively, as compared to lesser privileged feminists and activists working on sexual and reproductive health issues, or women's health issues, if we can call it, in the United States. And from the original concept by these activists belonging to Sister Song and all, you will know that it's about, the right to form a family and the right to parent a family safely, right? Or right to parent your children safely in an environment also emerged as important aspects of reproductive justice. So we want to build on that and say, hey, if we had a justice lens or a justice framework to sexual and reproductive health and rights, how are we able to do it effectively, right? And is it workable or not? And is it something that advocates can actually use? So we actually kind of floated this idea, starting at a partners meeting of Arrow and Arrow's partners. And what they had actually told us was that they saw reproductive justice resting on the concepts of reproductive health and reproductive rights, right? So that She said, don't throw away reproductive health, don't throw away reproductive rights, because reproductive health as a concept helps us intervene within the health sector and do our advocacy as we have done. And reproductive rights helps us hold governments accountable too, because these reproductive rights are, kind of defined within human rights mechanisms such as CEDAW and HRC, and also because our governments have signed on to it, right? But what reproductive justice helps us to do is to have a intersectionality lens to the work that we do and help with movement building, right? And it interrogates power, because within reproductive health and reproductive rights as, original concepts, this is not happening. So hence, that is why the concept that we have like kind of extended and what works for us in Asia and the Pacific with our partners. And by no means this is not the Bible. This is still a working concept. So new things could come up, right? Because some of these things are continuously evolving. So to start that off, I wanted to say that, okay, as you know, we had this, ICPD plus 30. This was the time that we talked to our partners, and we went back, 30 years and said, like, so what has worked for us, or how helpful was the International Conference on Populations and
La
Development,
conférence
right?
internationale
The ICPD
nous a
brought
aidés.
together different stakeholders, governments,
क्या क्या
NGOs,
जो
donors,
है
in order
लोग
to
हैं
chart
कौन
out
कौन है
the
धारक
vision
हैं
for
जो
people in development, right? So the lead up to the ICPD was through, again, a national and regional prepcoms where regional agendas were discussed and included. And the ICPD, in the end, I mean, is always remembered as that landmark conference, a landmark document which helped make the shift from demographic targets to individual and couple-centered rights and choices in policies and program around sexual and reproductive health. Okay, now I think I'm finding difficulty to move. Okay, wait, let's see. Okay, so in these 30 years after ICPD, you can see that from 1994 to 2023, 2024, we had geopolitical developments which call us to consider both age-old challenges as well as newer threats to SRHR. So in 1995, we had the Beijing Platform for Action. In 2000, they had this thing called the Millennium Development Goals, which, had something like, 7 or 8 goals in which, SRHR and ICPD were completely left out. It took them at least 5 years to include. So in 2005 only, they included targets on SRHR. But again, these targets are the very loosely defined targets on contraceptive prevalence and unmet need. Okay. Then in 2014, you had the ICPD plus 20 anniversary and the continuation of the ICPD program of action till goals are met. And in the Asia Pacific region, it's contained in the 6th APPC document. If you're from the Latin American region, it is called the Montevideo Consensus. And a similar document also was in the African and the MENA regions, right? But all of these regional documents had different how do I say, standards, which were regionally created, of which Montevideo is considered the most progressive. And then in 2015, we had the Sustainable Development Goals framework, also establish also regional mechanisms for follow-up. And in our region, in Asia Pacific, is the Asia Pacific Forum on Sustainable Development. And in Africa, it is also an African Forum for Sustainable Development that meets annually. So, but in 2020, we saw the COVID-19 pandemic, climate change-induced disasters, and rollback of gains in health, poverty reduction, and human rights. So these is like a snapshot of what has happened in 30 years. So pushing the envelope, right? So after post-2019 or the 25th anniversary, so the world we have lived in, putting this pandemic, climate change, unending global conflict has actually taken us backwards, right? And increased and deepening inequalities have actually called us to think differently and nuance our understanding of the issues and ensure our calls to ensure people's rights, especially those most marginalized, are being fulfilled. So, and as a recap, Aero Partners told us that in championing the reproductive justice framework, we should ensure that this rests firmly on the health and rights paradigms. And of course, I think sometimes, you can see how the worldview has changed in the last 30 years, that many of these issues, like even access to safe abortion, which is something that we consider to be very vital, is kind of considered as a elite feminist agendas, right? That many people cannot relate to, which is actually, in my personal opinion, is bollocks. Because when we apply an intersectional issue, we know for sure it is the most marginalized persons that really require access to safe abortion services. So the key parameters for us to consider: how does reproductive justice build on health and rights? What are the gaps and what can we push for, right? So in this PowerPoint, in this presentation, some of the things that not only me and Arrow partners and also Arrow staff, it's inside our Arrows for Change issue on reproductive justice. We consider equity, which is a triple AQ. So the triple AQ is a framework for care, right? The affordable, accessible quality of SRHR services for marginalized groups. We have legal frameworks, and we discuss limitations on access, especially to the marginalized. And then violence and linkages with SRHR need to be considered. Then there is also, of course, technology. And this is one of the pieces. Violence and technology is the evolving piece, because technology is rapidly developing, even as we are in this webinar, I guess. And of course, brings with it promises and possibilities, limitations and threats as well. And then, of course, care work, and how originally care work was considered part of reproductive labor and reproductive rights. So let's talk about equity. So equity is defined as the absence of systematic disparities in health between groups with different levels of power based on social advantage or social disadvantage. So equity is closely related to power, So we know that in all of the things that we often write about, and if you look at the demographic health surveys, every demographic health survey across every country will have this similar wordings, which says that women from the lowest wealth, social, and education quintiles, those who live in rural and hard-to-reach areas, from ethnic, religious minorities, castes, and indigenous populations, continue to have lesser access to SRH services, whether the service is contraceptive, antenatal, delivery, safe abortion, HIV, STD screening services, or support services for gender-based violence, right? And this results in all of this will be lower rates of met need for contraception, higher rates of maternal mortality and morbidity, amongst other unfavorable.
Can you go just a little bit slower, please?
Okay, so this of course then results in lower rates of met need for contraception, higher rates of maternal mortality and morbidity, amongst other unfavorable sexual and reproductive health outcomes. Now, and then of course we talk about how ensuring equity between different groups becomes key in the post-pandemic climate disaster devastation, times where poor communities experience multiple crises that keep perpetuating the cycle of impoverishment. But even as the demographic health surveys create this paragraph right on top that we are seeing here, there are a lot of blind spots to this, right? And in this, you can see that, younger women are left out. And across different countries, especially in the Asia Pacific region, the demographic health surveys may not be asking questions or may not be collecting data from unmarried women. As far as I know, I believe the last time I saw, only Cambodia and Philippines collects the data, but in Philippines, they don't report the data. I mean, the final number when you talk about met need is just from married women, right? So this is something that you may want to think about. This is a blind spot. And of course, alongside that, there are many other blind spots, right? Young women and girls with disabilities, indigenous groups, some of that data may not be widely available. Okay, and then of course, including those belonging to LGBTQI populations as well. No. So the equity challenge is usually caused by system limitations, right? Because everywhere across the world, we have seen governments undertaking, austerity measures, of which social services are always cut. And in that, the health system has not had as adequate, how do I say, protection, and has not been able to grow sufficiently. So governments investing in robust, resilient health systems in an era of austerity measures and reduced public spending is one of these reasons. And it is quality is an issue. Quality of services in an issue for poor and marginalized, right? The comprehensive services that were per the ICPD ideal, this is in paragraph chapter 8.25. You can go and search it up. It gives you a whole thing of like life costs. I mean, what are the SRH services available to us across the life course, right? Life cycle. And you can see that our health systems do not provide that 30 years later. Okay. The second one is that it lacks inclusivity. And I've also talked about how women and girls with disabilities face especially challenges to SRHR, but also young people and people with gender diverse and sexual orientation identities, right? So so there are many ways that systems are not able to accept the marginalized within their, how do I say, when they cast their net. Then, of course, there are data limitations. Older persons and adolescents are all left out of all SRHR surveys, as 15 to 49 is known as the reproductive age. So when they talk about women of the reproductive age, all of the data we are seeing is 15 to 49. Then, of course, the equity challenge is also caused by fragile contexts, right? So even if though we may have like, CPR, we do not know in climate vulnerable areas or in the impact of crisis on whether it is, climate vulnerable conflict areas, we have not been able to little recognized, and the systemic marginalization is amplified during those fragile contexts. And the cycles of poverty, they reinforce SRHR deprivations. So you will see in these marginalized communities, early marriage, gender-based violence, increased care burden, early pregnancy, and then, of course, resultingly, this pregnancy-related death or disability also occurs. And so this is the life of a vulnerable person from a vulnerable community. Okay, so this is what we see in the equity challenge today. And we know more than this one that there are many fragile contexts in every country. Now, so what are some considerations in equity that young activists can think about? So equity for younger women, adolescents, and gender diverse persons can and should be interrogated through the lens of gender power dynamics and age dynamics within the household. Right? So when we look at access to resources and access to resources such as time, money, assets, are determined by elders in the home. And then so you have reduced decision making in all aspects of life. Informal policies that are put in place by service providers such as parental and spousal consent. And then, of course, in some countries, you may also have guardianship laws. That means a young woman or a woman, even a grown adult woman, cannot go to a place outside of her home without a male guardian present, or cannot sign on to any form without a male guardian present. And of course, lastly, I think, and all of us have seen this, moral policing by authorities, right? So this also happens. But these are all happening in that gray area between what is formal and what is informal. So we have also seen laws passed to limit young people's decision making around marriage. And in India, you have this famous POXO Act. And then also sexuality decisions that you have seen, I think, in India, a young woman in the state of Kerala who decides to marry a Muslim has the judge saying, hey, you can't make that decision. Now I'm returning, although she's above the age of 21, returns her to her parental home. And so this is like, so you cannot decide around marriage. And of course, sexuality decisions is also about how countries across the world are trying to what they call harmonize the age of marriage with the age of consent, saying that, of course, because in the previous, in many countries, what happens is the age of consent is lower than the age of marriage, but there are moves to harmonize them and make them the same. But there is a lot of then a lot of decisions that are made below the age of consent are then considered as statutory rape or things like that, right? Although these are consensual decisions made by young people. Then lastly, of course, youth are not homogeneous. So in most places, we have to interrogate who amongst the young are most marginalized, and we even have to think, are they even in our spaces? And how do we try to reach them? So would a cross-movement approach work? For example, to reach young migrants, work with the migration movement, because very much the way even we do our advocacy is very much within our own spaces and our own silos, right? So a lot of this movement building work, I feel, comes from a reproductive justice approach as compared to the SRHR framing that we've had so far in our work. So taking a breather, because that was a big thing. So equity is one aspect. The second is, of course, violence. And longest time, it wasn't sexy to talk about violence because, donors and governments like to think that once, we've made a law, we've done whatever we can, and then, that thing is, the job is done. However, we know for sure that during COVID-19, there was the shadow pandemic and it was violence just came up everywhere, right? And violence is intertwined with SRHR needs, but also reinforces bodily autonomy and bodily integrity. And one of the things that, when we read all of the literature on, whether it's women's rights, feminism, SRHR, one of the very sad things to read is that this violence is perpetual, perpetual facet of young people's lives, younger women's lives, lives of gender diverse persons, lives of persons with disabilities, all the way across to the end. So throughout the whole spectrum, and then even when we come to older persons and older women, you will see that violence is continues to be a facet, and this gender power dynamics plays in such a way that forever you face violence across the life cycle. So the interlinkages of violence and SRHR, and this is basically, I mean, you can see this evidence and all. If you want to read, you must read the WHO multi-country study. And there are many other smaller studies in which they talk about how violence and sexual and reproductive health is so closely linked because violence increases the likelihood of miscarriage. It results in premature labor or delivery. It also results in higher levels of depression during or after pregnancies, amongst other effects. There's also violence which is related to maternal mortality. And it's very sad because every time, you say, oh, women who are pregnant, who are going to become mothers, and society kind of, how do I say, elevates them and say, oh, we treat our mothers so well. But interestingly enough, many women face a lot of violence, especially when they are pregnant, so, and resulting in maternal mortality. I think only in Latin America that they have actually identified this as a strain and collect the numbers around it. There's also, of course, FGMC and maternal mortality, because FGMC is a form of gender-based violence. Then violence also
Siva,
results
just
in...
for people who don't know the acronym, it's female genital mutilation, correctly?
Yes, correct. Female genital mutilation and cutting, right? And the other one is violence also causes stillbirths and low birth weight babies. Violence also means that sometimes the woman has fewer antenatal care visits and postnatal care follow-ups. And then there's delayed entry into antenatal care, right? So, and sexually, so, and also an increase of STIs and HIV risk behaviors. So these are the ways in which violence and SRHR are very closely connected. And you can see in the SRHR outcomes whether or not a person is undergoing violence, right? And violence is the way in which systemic hierarchies and oppressions are manifested, right? Whether it's patriarchy, casteism, ageism, sexual and gender non-compliance. Protection against violence strengthens bodily rights, including for both bodily autonomy, that is the right to make decisions, and bodily integrity, which is right to how to say, protect yourself from violence. So persistent violence is underlying cause is like, you have persistent gender equality. So there's laws, there's implementation gaps, and then there are newer forms of violence. So we haven't kind of adequately addressed the older forms of violence, but at the same time, we are also facing newer forms of violence, especially technology facilitated GBV. Then we have SRHR linkages are lesser addressed, right? And considered. And interestingly, a lot of literature also has pointed to that if we were to look at some of those things, it was that, repeat miscarriages, low birth weight babies, delayed entry into antenatal, how do I say, difficulty in following up with antenatal or postnatal care as like triggers, for us to think, is this person facing violence, and then how do I also take care of that aspect? So this is where the comprehensive approach is not there, right? So it's like, oh, you've received contraception, okay, and then you're fine. You've delivered safely, you're fine. You didn't die, so you're fine. And then the health system releases you. So it doesn't look at all of the different needs that a survivor may need. Then, of course, there's also reinforces domination and subordination hierarchies, right? So whether it's male domination, caste domination, and violence is used as a tool to punish and ensure compliance. And this is something we need to think about because, in fact, in many facets of societies and in many groups, even till today, people think it's okay to beat your child so that your child will obey what you want them to do, right? Or it's okay for husbands to beat their wives to teach them a lesson, or it's okay for teachers to beat their students. And also, you'll be surprised that even when you go to a health service, sometimes women who are in great pain while delivering a baby face obstetric violence, that the healthcare service provider beats them up, slaps them, scolds them. And young people who go to get, comprehensive services like, contraception are also, again, cursed or shamed, or, gender diverse persons are again shamed by the way that their body looks and questioned. So these are all the different ways. So violence is the way that society reinforces the domination and subordination hierarchies. So some of the considerations for young activists is that, is a persistent facet of women's lives. Young women actually face higher rates of violence, and the violence that younger women face is largely sexual and gender-based violence. And this is in comparison to young males who actually have, it's either they get into fights, they get murdered, or higher rates of suicide, right? So the kind of violence that is inflicted between the both are completely different. And then you have young women, gender diverse persons are not facing not only intimate partner violence, IPV, but also sexual harassment and sexual assault, but also tech facilitated forms of violence. And then there are different spheres, so which are largely unaddressed, right? There's violence happening in schools in different ways. There's violence happening in work, and then there's violence happening in public life, right? And there's also violence and abuse from service providers when seeking SRHR services, as I mentioned earlier. And so the way that in which that we even track violence and look at violence is very narrow. Okay. Then you have recourse and access to justice for younger survivors of violence is largely constricted because either these aspects of family honor, so access to resources again, because the young person may want to go have justice or may want to seek counseling, may want to have anonymity, may not want to get married. So, right? For many of the statutory rape cases in many countries across my region, they think that the most acceptable thing is to get the rapist to marry the survivor, which is like for me is like, I mean, and I think for most of us is like completely like ludicrous, right? But yet, governments and authorities think that that's the best, and sometimes even the families thinks that's the best resolution. So all of this access to justice and access to recourse can be out of hands for younger survivors. Okay.
Eva,
Um,
just a quick notice about time. We have around 10 more minutes.
okay, fine. Then we have care work and reproductive labor. So, reproductive labor or care work stems from gender hierarchies and is perpetuated by the gender power imbalances in families and societies, right? And so, women in Asia and Pacific work longest hours and unpaid reproductive labor and care work. And this reproductive labor is like childbearing and rearing, cooking, cleaning, washing, caring for the elderly, the sick, and the disabled. This is actually hard physical labor, and as well as is not only physical but mental and emotional labor, and has costs in times of time and energy, right? And reproductive labor, and I think there's been a lot of discussion, it's necessary for the continuation of society and economic functioning. So the lack of opportunities and choice reinforces the economic subjugation of women at the micro level and the feminization of poverty at the macro level, right? So, and it reinforces all of the racial, ethnic, caste, economic subordination through the persistent undervaluing of reproductive labor. So those who are called to do the reproductive labor are very often like migrants or those at the lower power ranks in society, in our societies. So, and usually the call for care work is to recognize it, to reduce it, and to redistribute it. So some of the considerations for young activists is that care burden is a gender issue. Not only women, but also girls had to drop out of schools and schooling in order to help their mothers with care work. This is being replicated in climate vulnerable communities, conflict situation, and economically vulnerable communities post-COVID. So there is in the era of what is called the polycrisis, reliance on women to shoulder the care burden is increasing, and in some senses now is even becoming glamorized, isn't it? The trad wife on social media phenomena. So it goes hands in hand with renewed calls for traditional gender roles, and this is something that has emerged in the last 5 years or so. So it is provocative for us to think, have we taken such individualized takes on feminism have clouded some of this, what like things like Karwa Chowd, acceptability of polygamy, they have facilitated a traditional gender roles now, which is glamorized by media. Then you have legal frameworks. So legal frameworks is one of the things you may want to think about is that law and policy changes such as raising the age of consent to the minimum age of marriage we talk about. So sexuality is within the framework of marital heteronormative framework, right? Mandatory reporting of sexual activity of adolescents that sometimes service providers are asked to do, or teachers, or resorting to court adjudication on love, romance, marriage, have increased parental and family control over adolescent sexuality and acted to strengthen regressive social norms. So, and then you can see that criminalization, stigmatization, and often pathologization of sexuality, see young people, adolescents not being able to access the sexual and reproductive health services that they need. So you can see that mistimed pregnancies between 15 to 19 to 20 to 24 across all of the demographic health surveys, regardless of whether they are married or unmarried, is indicate that age and marital status play an important determining role on access to contraception, which is driven by social taboos on premarital sexual activity. Okay. And wow, so much. Abortion laws and sodomy laws are commonly mentioned. And in these, the assumptions are that sexuality, agency, autonomy, and privacy of individuals and couples then hinder the full attainment of the sexual and reproductive rights, right? So where abortion has been legalized, there continues to be issues of access, especially with regards term limits. There's often poorer, marginalized women who come for termination services later due to cost, distance, and transport barriers. So abortion is central in the reproductive justice framework because an unwanted pregnancy is a result of intersecting marginalizations and vulnerabilities and failures, whether this is economics, violence, access to health systems and services, information and education, access to suitable methods of contraception, access to healthcare insurance that covers contraceptives and reproductive health services, as well as autonomy, the right to make decisions, right? So things like legislative or provider-induced delays, whether it's waiting periods, parental or spousal consent, court orders, or psychiatric evaluations, make it harder for poorer, younger, those who live in remote areas or come from marginalized social identities such as migrant, disabled, indigenous, lower caste, trans persons to access the abortion services they may need. So abortion is then a necessary central SRH service for young people. So the decriminalization, so the call is often to decriminalize laws regulating abortion, adolescent sexuality, premarital sexuality, same-sex sexual relationships, gender identity, discrimination based on pregnancy and HIV status will help improve the sexual and reproductive health outcomes for the most marginalized groups in our society. So then they, oh my God, there's another whole technology. Okay. So I'm not sure, Dominique, how I've got to go very fast now. So in COVID-19, there was an accelerated shift to
It's
digital
okay. We
health.
can we can we can dedicate 7 minutes to
Sorry.
to the rest. It's okay.
Now I have to go like a speedy train. So
No.
87, so
It's okay.
so after COVID-19, WHO did a study, or because they were mandating this investment to digital health. And you can see that 87% of countries investing in digital health for health system recovery, resilience, and preparedness. So in SRHR, digital health interventions have been used in these areas: medication abortion, contraception, STI testing, supporting post-abortion contraception, improving knowledge and use of contraception, improving safe sex behaviors and practices, and for outreach to high-risk groups such as sex workers and marginalized groups such as adolescents and young people. So let us all think about it, because this is something we've all done, right? Because we either do self-help groups on WhatsApp, we do outreach through our social media platforms, we do support around social media platforms and all of that. So, but we also need to know that the global north is already operationalizing, but in global south, more marginalized populations may need not only digital health intervention, but they also need greater support in accessing and using things like medication abortion, such as hotlines, trainings for health providers and pharmacists, and provision of information, amongst others. There is a digital health equity framework. You can search this up and you can see that digital health determinants such as access, literacy, values, and norms also interact and reiterate other existing social inequities. So digital health now can also be viewed needs to be viewed with an intersectional lens and take into account added security risks to women, girls, and marginalized people. And this is what we have seen, like, ever since, like in the US, the removal of Roe v. Wade, and you saw these groups being, that people were going after women and girls who were seeking services. And sometimes, and not sometimes, but at all times, we have to know that governments are one of the big buyers of data from social media platforms. So everything that we have on something, that data is going to be sold. So it depends on whether the government is receptive to some of these SRH services or not, and how that data can be used as a tool for identifying and going after activists and advocates, as well as lay people who are utilizing the service. So yeah, so this is, and so some of the flip side of the digital health is sometimes digital health, we think it's a great leveler. it gives privacy and everything, but that's only for very perhaps wealthier people and more elite people, because very often they are gatekeepers, persons in control, such as parents, spouses, abusers, having access to the devices, being able to track the usage of apps around violence, contraception, abortion services, or to place surveillance apps even within the digital device, right? So safety, privacy, and ownership of data shared with such platforms, should authorities request data from the platform owners, as I have mentioned before. The state and authoritarian surveillance. And then, of course, there's biases in design of digital apps and platforms, which have already been seen as skewed towards white male models, results in biased algorithms, right? Which misdiagnose or underestimate and underdiagnose health issues amongst marginalized population. So some of this one is that, the digital world is a new reality for young people, and you all have to live with it in a way, in an unfettered way, as compared to us. And then, of course, there's unfettered growth in AI, digital technology, digital surveillance in ways that have never been seen before. There are lack of laws that ensure data privacy, data ownership to safeguard current and future generation. And of course, there's a dilution of rights, like workers' rights. So, in the big gig economy. And the reason is because there were social protections, of paid leave, social insurance, and pension plans, which are connected to health rights as well. But this has changed in this generation. And then there's, of course, unprecedented data collection on free social media. And then, of course, there's exposure and risks of the dark web, where modified videos, images, voice, and dark web organizing of misogynists. And this is something that we know, there's lots of, there are groups which share, pictures of women and girls, young people, gender diverse persons are being shared and traded without permission, almost like a Giselle Pelicot in virtual reality, but like on like steroids. So moving forward, so some ideas, it has to be inclusive, interlinked. Let us look at interlinked rights, make it intersectional. Let's talk about systems change, right? So these are like the four things that we have. And then this is just, it's a diagram, it's a kind of a drawing that we did, or a graphic graphic drawing that was done to kind of capture all of the different aspects that we have talked about. So with that, I have to say thank you. And do you have any questions?
Right, so I can see two questions in the group chat.
Okay. It's okay for me to stop sharing, right, Dominic, so I can look
Yeah,
at the...
sure. One of them is, what benefit does the government get from buying data?
Yeah, see, this is what I also don't understand, but they, okay. So, why does the government buy data? Because they are very interested in how groups are organizing, and it's just not government, it's also private sector. And I have, like, how do I say, many, many conversations and people across different sectors as well. And I think very recently, in even one of my nephews, so there are private sector organizations, like a company. Okay, so he was working with a company that was running a theme park. There would be accidents in theme parks, which citizens will try to report the accident, right? And say, hey, you ran this theme park, there was a death, what happened? And what will happen is that comms department in these places actually go, or the PR firms that are hired go and put all of this information inside to try to put a positive spin, like, oh, that was a small accident, nothing happened, this is a great place to go, my family and I had a great time in this. So you would see this when you are looking at many of these posts, right? So you'll see one or two people trying to raise an issue, and then people will shut them down and shift the narrative, right? So that's one aspect. So how do they get the data that we have posted such a comment? So somebody is tracking, right? So there are keyword searches which you can buy from social media companies in order for you to be alerted. So that's one thing. So governments also are actually tracking this. So they know who has made a comment about such and such a policy. So they've either buy these keyword searches and they can do that, right? Then from there, they can say, they're not going to say, I'm going to buy the data of 100 million people at one go. They'll just say, I want to track the activity and thinking. Who are these people organizing? Who's giving them money? How are they meeting? Where are they meeting? What are the platforms there? This one. That's how we know, like, for example, when we use how do I say, when we use things like WhatsApp, suddenly you'll find somebody comes into that group. We're not really sure who that person is. Well, this is clearly then the people who are buying this data and who want to track us know that this person has come into the group to kind of get the information on what our plans are, right? But for those of you who have lived in countries where there has been a lot of surveillance, because I can tell you, I come from Malaysia, and Malaysia, we are just used to it. I mean, like before the era of social media, also, if we had a talk, if we had a dialogue, definitely the police, the special branch, and everything are present. You know, from far, you know, okay, those are the special branch fellows. They just want to know who is attending, you know, so they have got extensive records of who is going for what event, who is mobilizing around what type of groups, and who is having what thoughts. Okay, so this is how they do that. Okay, so now, can you share some examples of how the reproductive right justice framework has been used by abortion rights advocates? Okay, so this is interesting because, as you know, I think that in the US, the reproductive justice how do I say, framework was developed because it was not only about access to safe abortion services, but also the right to parent, right? And the right to have a family. I think that moving forward, we will see more need for the reproductive justice framework simply because of the way that how the right wing has framed our issues of individual elite women or individual elite feminists trying to impose a sort of agenda on everybody, an unnatural agenda. So for us, the reproductive justice framework is going to be very useful because we have to say, hey, this is an issue of not only young people, of women and girls with disabilities, of gender diverse persons, women from indigenous communities, people who are living in climate vulnerable areas. So it allows us to do constituency building beyond our normal silos, okay, of working. Now, would you have ideas of solutions to protect our communications organization from state private sector data collection? I would love to have that. And I think that there's always this evolution into safer forms of communications and safer platforms. So, you know, as you know, some of us are only on Signal as versus WhatsApp. Some of us are going from, you know, encrypted to encrypted, right? So this is supposed to be very safe, but always our problem is that we are sending messages to a whole variety of people from one email address. So not everyone, every recipient is encrypted, right? So some of our communications will be then at risk and some are not at risk. Some people have told me that they have resorted to analog lives. But I'm not sure whether how young people feel about analog lives. I have a lot of, how do I say, reminiscing about the analog life because I don't like a lot of communication all the time because I find it a little bit distracting, but this is entirely up to you. I'm just wondering if somebody can translate for me what Sarita has put here.
Yes, I'm just putting that on chat.
Thanks.
In the meantime, about solutions to protect our communications, actually, you know, Lana, things are tightening, right? Because you see that the Meta has, for example, quite a big influence, right? And we've seen this last week when it decided to randomly blur and take down abortion activists' platforms, right? But there are always other ways to keep this going besides, you know, just working with communities. You also have Reddit, you also have Blue Sky now. I think it's gaining a lot of popularity. Pinterest, I've seen people go back to Pinterest to promote abortion access. What else can you use? But for security, I think, in part of I think the biggest concern here is criminalization, right?
Correct.
After all, right? Where do you go if things suddenly become criminalized? You nowhere. You have to
Right.
do it on the ground, unfortunately, I say. But yeah, Signal is a great one. And now, for example, for meetings, Jitsi is hosted on Greenhost, and it
Mm.
does not require an account to log in like the normal Jitsi would. That would also be better, I guess, if you're looking for places to meet. But until something new develops, I would say that Signal continues to be one of the main ones, more secure platforms that you would use.
Mm.
Yeah, just my 2 cents on the topic because I'm also very and if you keep databases, you could try Airtable. It
Mm.
worked well, and it is not unsafe yet. But I would also say that it's good nowadays to have an IT person or somebody who works in that domain to just keep eye on everything, because nowadays, they're just adding things into terms and conditions, and they're changing it without you knowing, right? So keeping constant control of that, I think, is paramount. Okay, Sarita's question. Can you please tell if the government takes money from providers who overcharge for abortions?
Yeah, I think that there are a few things here. I believe there is no data whether the government takes money from providers who overcharge for abortions. But I do know that in many of these places, as we know, once you go into the private domain, right, it becomes unregulated. So unregulated will be around price and access, affordability, as well as quality. And so I don't think it's due to just whether government, I mean, and who is this government who's taking, right? So I don't think that it's far because a lot of people also feel inside countries that private sector around health should not be regulated, but all our experience shows that private sector needs to be regulated. So how can we manage those who overcharge? And I think Silverline has also asked a similar question. How can we manage those who overcharge for abortion access and keep them in check? And again, for me, the best way to manage it is by making it legal and accessible through the public health system. And there should be no stigma around it, so that it's so freely available and knowledge around it is so free that nobody can make money out of it, right? So the whole thing is like only when you make things illegal, put the red tape and bureaucracy and all of that, then this overcharging, putting it underground or making it seem like something illegal, even when it is legal. And this happens across so many different countries. So I think there needs to be a lot of education and information going out and saying like, hey, but of course, it is only in places where this where abortion is under, or it's either made illegal or made difficult to access, that this happens, rather than in like places where it's more broadly legal and decriminalized. And almost always there will be a number of different laws. And I think that you can read CRR's uh, they come out with reports on abortion access legal frameworks, right? So you can see like sometimes there could be the broad laws allowing for abortion access, but then there'll be so many different policies that prevent it, right? So or manage it. Yeah. So this is what I can say.